this next section, we're going to be looking at your skin and your wound evaluation. This is going to be the third step in healing your foot wound fast. It's very, very important to look at your skin, especially around the wound, and to do a clear evaluation of your skin. Because many times when you have a foot wound, the skin around it may have a fungal infection, may have an actual skin or infection in the skin around it, or there may be other problems with the skin that can cause the wound to be slow to heal. I'd like to start telling you about a patient that had a foot wound for many, many months, and this foot wound was very, very slow to heal. And what ended up happening is this patient had an actual fungal infection right around the wound that made it very, very difficult for it to heal. It's very challenging when you look at the skin. When you look at the top of the foot, you have to do a whole skin evaluation. When you do that, initially you look at a few elements. You look at the nails. Are the nails normal looking or are they thickened? If someone has a thickened nail, a fungal nail, here's an example. This fungal nail can be difficult to trim, but as well, it can be a problem inside of your shoes. For example, if your shoes are too tight, it can cause a blister on top of the nail. This can be very painful or not painful if you have the neuropathy. Another problem with the skin that can happen is you can have an ingrown toenail. Very, very common with people with diabetes. The nail edge grows into the side and it can become infected or painful. If this becomes infected, you may need to have an antibiotic or have a portion of the nail removed. Here's an example of an ingrown toenail. And here's an example of how you remove an ingrown toenail, where you remove a little edge of the nail. This can be easily done at your doctor's office. The next area of the skin to look at is if there's any dryness of the skin. One of the conditions with neuropathy is it can affect your nerves to your feet, not just the nerves that have sensation though. It can also affect the nerves that cause sweating. Here's an example of someone with dry skin. This dry skin can be due to just dryness, or it can be due to lack of sweating. This is very common with people with neuropathy. They can lose the sweating component of their skin. The next aspect we're going to look at is actually the most important for people with diabetes. It's calluses. Calluses are on the bottom of the foot. Corns are on the top of the toes or top of the foot or between the toes. Corns and calluses can be a problem because if they're not treated properly, if they're not trimmed frequently, if they're not treated by a professional, that callus actually has an increase in pressure by about 60% underneath it. By trimming them off, you're reducing that peak pressure, but if you don't trim them, it can make it more susceptible to developing a foot wound. By and large, what I see in my practice is that someone that has a callus, someone that has, usually due to a foot deformity, someone that has neuropathy or poor feeling and poor blood flow, that all can be leading up to developing a foot wound or an ulcer. These calluses, they can happen at a lot of different places on the foot. The most common place is in the bottom of the big toe, or on the bottom of the front of the foot, or at the heel, or anywhere there's a bony prominence. Here's a few pictures of calluses that have turned into ulcers. Here's one on someone's bunion. You can see how it rubs on the side of the shoe. Here's one on the bottom of the big toe. And here's one into the front of the foot. These are the most common areas where we develop ulcers and calluses on the feet. Calluses need to be treated by a professional. Another area I want to discuss in terms of the skin is between the toes. When you look between the toes, here's an example. It should be nice and clear. There shouldn't be any dampness. If there is dampness between the toes, it can cause what we call maceration or whitening between the toes. And this whitening can very easily get a cut and cause an infection in the foot. Here's an example of someone that had a foot infection due to dampness between the toes. The next area we want to look at is the actual ulcer itself. We have to understand what causes the ulcer. The ulcer is normally caused by friction, by pressure, or by something we call shear force. Everyone knows what friction is. Friction is rubbing. When you're rubbing and when you're walking in your shoes, it causes this rubbing motion. And this friction, along with the pressure or the weight of your body, can cause the ulcer, or this is called this shear force. It's a combination of both of them. If you have a foot with good feeling, it's not going to be a problem. But if you have a foot that doesn't have good feeling and you're constantly having that friction on the bottom of your foot, it's going to develop a callus or a blister. Both of these can lead into a foot ulcer. Very important to know. That's the reason we do and we recommend the diabetic shoes, because that can reduce the friction on the bottom of the foot utilizing those special inserts. In terms of the wound, let's look at some wounds now and evaluate the anatomy of the wound, or what a wound looks like, what you're looking for in your wound. First, we have to look at the most important aspect to look at, I think, in a wound is looking around the edges. If you look around the edge of the wound and there's a big callus around the edge, that's a problem. That shows that there's friction. Every time you see your doctor, you need to be seen for that callus. That callus needs to be trimmed off, and you have to get normal texture of skin around it. The more callus you have, the more standing or walking someone is doing. If you have a lot of callus around your wound, it's probably because you're up on it too much. That callus needs to be trimmed away, and then you have to evaluate the edges of the wound. Are the edges normal, or are you able to put something underneath the edge? Here's an example of a wound that's able to undermine, we call. Undermining is nothing more than, if you think of a cave where it has some rocks over the top of it, you can still get inside and the cave is actually bigger on the inside than what the hole on the outside shows. This undermined portion either needs to be packed with some type of gauze or some type of material, ribbon type of a band, or it needs to be opened up with a tissue nipper. By opening it up, you can actually show the actual space, because a wound always heals from the inside out. You never want to have a wound callus over the top because it's not healed. It's kind of like an avalanche happening over a cave. It looks closed, but really it's open on the inside. So that's how you look at the edge of the wound. You also have to look at the center of the wound. What color is it? Is it beefy red? This is an example of a beefy red wound. This is a very healthy wound. This is what we want wounds to look like. The more red, the more healthy it is, the quicker it is to heal, and the skin can form over the top of it. If your wound looks like this, and it looks a little what we call fibrotic, it's a yellowish base. If it looks yellow, that's in a wound that's slow or stagnant in terms of healing, and you need to use a certain type of either a dressing or a product on top of it to take away some of that fibrotic tissue and transform that fibrous tissue into more of that beefy red tissue. The other type of aspect of the wound, you have to look at how much drainage there is. Is there a lot of drainage, such as one of these leg wounds? Or is there minimal drainage? There's a dry wound. That tells you what type of dressing you need to use, but as well tells you what type of treatment is needed for it. If there's a lot of drainage, it can make all the skin around the wound very damp and macerated, and be at greater risk of making the wound look bigger or increasing in the size because it injures the skin around it. That would do better with the type of a foam dressing that we'll talk about. Another aspect of a wound, you have to determine if there are any signs of infection. Signs of infection usually are indicative of an increase in your temperature of the skin or your own body temperature, redness, pain, drainage, or any other type of symptom that you may feel, such as a flu-like symptom or an increase in your blood sugar. All these are very important signs that you may feel. An infection, if you have diabetes, may go unnoticed. There was an example of a patient of mine that he was seen in my office. He didn't have any signs, meaning he didn't have a fever, he didn't feel sick, but he had a raging foot infection. He didn't know about it until I saw it. That's why it's so important for you to look at your feet every day. Take your blood sugar every day. If you have a spike in your blood sugar, look, is there an infection somewhere else? Maybe it might be a bladder infection, maybe an infection somewhere else. But there's usually a spike in your blood sugar. And also if you feel sick, if you have flu-like symptoms, a cold-like symptoms, and you don't know why, take a look at your foot. That could be indicative of a problem as well. If there is an infection, if there's redness, if there's swelling, if there's pus or drainage coming out of it that's a different color, that needs to be treated. All infections need to be treated with antibiotics and possibly surgery. Antibiotics are important, but unless you get the pus out of the area, you're not going to clear up the infection. Here's an example of a wound that has an infection. And in order to drain it, that needs to be opened up and get all of the pus out so that it can heal up. Many times with a foot wound that is infected, all you need to do is drain it. Antibiotics sometimes aren't necessary if you're able to get all the drainage out. How do you determine how big the infection is or how far it goes? Sometimes you need to do either an X-ray or you need to do an MRI to evaluate the depth of the infection. These are very, very serious. Who's really at risk in terms of developing an infection? If you have a blister that's not treated, if you have a wound that's uncovered or you're walking barefoot, if you have a wound that's been open for a long period of time, all these make you at greater risk for developing an infection in a wound. Part of the reason for healing your foot wound fast is because the faster we're able to heal it, the less risk you're going to have of developing an infection. And it's usually an infected wound, not a non-infected wound, but an infected wound that's going to lead on to a bigger wound or even to an amputation. Because sometimes if the infection goes so deep, it can even go into the bone. One of the parts of the examination when you're looking at the skin is you take the wound and you undermine, you probe around the edges, but you also probe deep with a cotton-tipped applicator. This is what it looks like. In this sterile applicator, depending on how deep it can probe, if it can probe down to your bone, the bone may be infected and you're at greater risk. This is a very important test for you to do, to determine how bad your wound is. So what we've looked at here are the causes of foot wounds, a little bit more about how calluses contribute to it, and some of the signs of infection. And this is how you do your skin evaluation, looking at the nails, looking at the skin between the toes, the ulcer itself, and categorizing the ulcer. How big is it? Is it only a little blister, or does it go very, very deep? When you look at wounds, you have to look at the depth of them. Do they go just a little bit, a couple centimeters, or do they go down? Can you see a tendon, or can you see bone? The deeper they go, the more severe they are, and the more challenging, potentially, it can be for you to heal them. It's very important for you to have an accurate wound evaluation. We're going to go through now a few case studies and looking at some wounds at the different areas of the foot. Here's a foot wound to the toe. Here is a foot wound to the front of the foot. Here's a foot wound on a bunion. And here's a foot wound on the heel. These are the 4 basic areas that you can develop foot wounds. And we're going to go through and teach how to use these different steps on how to heal these types of foot wounds throughout this course.